You know when you take your pet to the vet and you see them doing all these, well, kind of weird-looking tests, waving a hand at their eye, touching their whiskers, turning their head back and forth? It might look a little random, but believe me, it's an incredibly smart and systematic investigation. Today, we're going to pull back the curtain and show you exactly what's going on.
Yeah, that's really the big question, isn't it? Our pets can't just tell us, hey, doc, my vision's a little blurry today, or the left side of my face feels kind of weird. So the vet has to become a kind of neurological detective, piecing together clues from their silent patient to figure out what's really happening inside their brain.
And the key to this whole mystery, well, it all comes down to this number, 12. There are 12 pairs of special nerves, the cranial nerves, that act like direct information superhighways running to and from the brain.
The best way to think about these nerves is like the brain's internal wiring. They're the communication cables that carry all the signals for sight, for smell, for feeling, for moving muscles. So by testing these 12 wires one by one, a vet can basically run a diagnostic on the whole system and find out exactly where a short circuit might be.
All right, so let's start our little tour right where the vet usually does, with the eyes. It's not just a saying, they really are a window to the brain. The first few tests are all about checking the pathways that handle vision and how the brain reacts to what it sees.
Okay, first up we've got the menace response. Now it sounds dramatic, I know, but the vet is super careful not to actually touch the pet or even create a puff of air. They're not trying to scare anyone. They're just asking two really important questions. One, does the brain see that hand coming? And two, can the brain then tell the eyelid to shut in response?
And here's the science behind it. You've got two pathways working together, an input pathway called afferent and an output pathway called efferent. So the optic nerve is the input, that's what sees the hand, and the facial nerve is the output, that's what controls the muscle that makes the eye blink. It's a perfect little circuit between two different nerves.
All right, next up, you'll probably see the vet dim the lights. This is for the pupillary light reflex, or PLR for short. They'll have a quick peek at the pupil size in the dim light, and then, flash, they'll shine a bright light into one eye. What they're looking for is a quick, sharp constriction, the pupil getting smaller in response to the light. Now this is what's so cool. This test reveals a whole different circuit. The input signal, the sensing of the light, is carried by the same optic nerve as before, but the output command is totally different. This time, the signal goes to the oculomotor nerve, which tells the iris to slam the pupil shut. So by comparing the menace and the PLR, the vet can get really specific about where a problem might be.
Okay, so we've covered the eyes. Now let's switch gears from sight to touch. The next set of tests is all about checking what the pet can feel, specifically on its face.
This one's called the palpebral reflex, and it's super simple. The vet just gently taps the skin right at the corner of the eye. It seems basic, but it's testing a really critical reflex that's designed to protect the eye from, say, a piece of dust. A healthy nervous system should fire off an instant full blink.
Okay, and this is where it gets really clever. The output, the blink itself, is controlled by the facial nerve. Hey, that's the same one from the menace response. But the input, the feeling of that little tap, is carried by a totally different nerve, the big trigeminal nerve. This is how a vet can start to figure out, is the problem with seeing or is it with feeling?
And to double-check that trigeminal nerve, the one that feels things, the vet will often gently touch the whiskers or the upper lip. The response they're looking for might be a little twitch, or maybe the pet pulls its head away. Either way, it confirms that the nerves for facial sensation are online and working.
So let's just recap, because this is super important. Think of it this way. You've got one main nerve for sensation on the face. That's the trigeminal. And you've got another main nerve for action, for making expressions. That's the facial nerve. By using tests that mix and match these two, the vet can zero in on which of the brain's wires might be the problem.
All right, we've talked about seeing and feeling. Now, the tour shifts to the nerves that are all about movement, the ones that are purely in charge of controlling the muscles in the head and face. Here's a neat one, the auricular reflex. The vet just lightly touches the inside of the ear flap. A normal response is a little ear twitch, maybe a blink, maybe even a little head shake. And what's really wild about this one is that the facial nerve actually pulls double duty here. It's responsible for both feeling the touch and making the ear twitch in response.
Okay, this next test is sometimes called the doll's eye reflex, and it might look a little funny. The vet gently and slowly moves the pet's head from side to side while just watching the eyes. In a healthy animal, the eyes will actually move in the opposite direction, keeping their gaze fixed. This is an amazing test because it checks the link between the nerve for balance and the 3 different nerves that control all those tiny eye muscles. It's a powerful way to check a whole network with just one simple motion. And a huge part of this whole thing isn't even these active tests. It's just looking, really looking. Is one ear drooping a little? Is one lip hanging lower than the other? Are the powerful chewing muscles on both sides the same size? These are all visual clues that can point the vet toward a weakness in either the trigeminal or the facial nerves.
Okay, we're on the home stretch now. These last few checks look at some of the most basic, most important functions that are controlled by the nerves at the very back of the head.
Now, nobody loves the gag reflex test, but it's checking something absolutely vital. The vet will gently touch the area around the larynx to trigger a little swallow or a gag. This checks the input from the glossopharyngeal nerve and the super important output from the vagus nerve. These two have to work perfectly together to make sure your pet can swallow safely without food or water going down the wrong tube.
And for the grand finale, the vet takes a look at the tongue. They're checking to see if it's nice and symmetrical, if it has good muscle tone, and if it moves properly. Any weakness or deviation to one side can point to a problem with the 12th and final cranial nerve on our tour, the hypoglossal nerve.
So, let's step back. After all those little pokes and lights and head turns, what does our vet detective actually know? Well, without the patient having to say a single word, the vet has just built a detailed map of the brain's wiring. They have a clear picture of everything from vision and balance to facial sensation and swallowing. It is an incredibly powerful diagnostic tool.
And that really brings us back to you. Now that you know a little bit more about what your vet is looking for, you can be a better detective at home. A tiny droop in an ear that wasn't there before, a change in how they blink, a little trouble swallowing. These are all clues. So the question is, what clues is your pet giving you?